Dr. David Bedabaugh here, Canale Chiropractic Relief Center. I want to talk about knee problems. Most of the knee problems are avoidable. It's simply that we have to get them in the best shape we can ahead of time. Often people allow this range of motion limitation to be okay. It's actually not okay because we eventually fall and are forced beyond that point and it tears it, which could be an immediate surgery. We really want to get them all the way to this level where they go all the way. I don't do this to show off. Both knees have been recommended surgery. It took a long time to rehab them. But you hold on to something balance-wise and you want to stretch it out. Now you may not be able to get there in the beginning. Maybe only to get here. You may be recovering for something. You may have to grab onto the cuff or a towel and you start off stretching at a lower level. And you grab and you shake it off. I stretch again. I shake it off. Literally that quick. And then I pull it further. And eventually it might be a year before you're getting up to touching your heel on your butt, okay? But remember, whatever you're doing, you bring it backwards and pull it as far as you can. Never bounce. Don't force it through any pain. Be patient. It's a little bit every day. Don't try to build Rome overnight. This is something that takes time. Another exercise for the stretching is also this one, where you get on a padded surface. It could be something like this. It could be on a carpeted floor. And you start it up here, and what you're doing is you're gradually going as far as you can. You may find that one leg goes farther than the other because they're not equal in the beginning. And what you're doing is you don't bounce, but you just try to get to a comfortable place where you can rest and let your body weight slowly, carefully, be careful. Weight, how much you weigh makes a difference, so don't try to do it quickly. You just do it slowly. And let it ease a little further, come out of it. And then go back and you're working at trying to lean into the one that needs a little bit more. Be very careful with it. Again, do not bounce. It took me more than a year to get this one to be able to go this far and then lean back like that. So what you're doing is you're stretching out the hamstrings, but you're also fully moving, articulating the joint. The more the joint moves, the better it hydrates and the safer it is. Wherever you don't go, it dies. Wherever you don't go, it becomes brittle. Same thing with a hip. If it doesn't go out all the way, only part way, you fall on the back portion, it's brittle back there. Now you have a big injury and say, oh, it was my age. No, it was neglect. Let's get them moving. So now we need to talk about the strengthening application of the knees while you're getting the range of motion. That's on part 2 of this video, so stay tuned for that. Dr. David Bedabaugh. If you have any questions, feel free to call. Thank you.